A new study from the Mayo Clinic says adults with asthma have a higher risk of developing serious bacterial lung infections. Joining us now to talk about this study is Dr. Stan Waspin, a member of our Medical Advisory Board. Thanks again for being here.
Thank you.
First of all, tell us about this study.
The researchers looked through medical records of nearly 4,000 Minnesota residents, trying to determine what the link was between asthma and pneumococcal disease. Pneumococcal disease is a serious bacterial infection of the ears, the brain, the blood, the lung, pneumonia. Now, this infection sends 175,000 Americans to the hospital every year and is responsible for more than 6,000 deaths. The salient finding of this study was that adults with asthma are 7 times as likely to develop pneumococcal disease relative to non-asthmatic adults.
Okay, these are certainly serious infections. How can they be prevented?
There are 2 pneumococcal vaccines that are on the market. And since the introduction of the pediatric pneumococcal vaccine at the beginning of this decade, we've already seen more than an 80% reduction in the incidence of these infections, which is especially fortunate since this bug is getting increasingly resistant to antibiotics. Now, the adult pneumococcal vaccine is known as the pneumonia shot. It's very safe and very effective. If everyone got this vaccine who is supposed to get it, we would save more than 3,000 lives every year in this country alone.
And that brings up a good point. Who should be getting this vaccination?
Well, the point of this study is that asthmatic adults should get this vaccine. Once they get it, they're protected for at least 9 years.
Okay.
It's recommended also for other population groups, those over the age of 65, and in general, anyone who has a weaker immune system should get the pneumonia shot.
Okay, good information, Dr. Stan. Thank you again for being here.
When you think health, think IRU.